so much for joining us. I'm Madelyn Gustafson, like Robbie said, from the National Environmental Health Association, and so excited to have Dr. Henderson and Nichole with us. Just like Robbie said, think globally, act locally is advice we hear really often. But what does that look like for climate action, and how can that improve health and health equity? So to start our panel discussion, Dr. Henderson, can you describe the local impacts of climate change in your area and how this impacts your approach to climate adaptation and mitigation strategies?
Right. Well, first of all, thank you so much for having me. I am in sunny Miami, Florida. A lot of people know it as the place where people come to vacation. But for people who actually live here, it is a place that has hurricane season every year. And so as climate changes, so does the weather. And with the changes in weather come stronger hurricane seasons, longer hurricane seasons, and just all the weather events that come along with it, heat, et cetera. And so people who live in Miami community, particularly those that live in working class and poor neighborhoods here, disaster is on everyone's mind. And so locally, we've developed ways in which to educate not only community members, but medical providers and things of that nature to help people mitigate those risks, to become more resilient, and to respond to people before, during, and after hurricanes as well. So that's really what my work focuses on here in Miami.
Great. It sounds like all great things, except, definitely need to address the impacts on the Miami region and in the coastal areas in Florida. Nichole, can you describe the climate change impacts in your region and how this impacts your approach to climate action?
Sure. Thanks, Maddie. Really happy to be here. Franklin County Public Health is in Columbus, Ohio. It's Central Ohio and home of the city of Columbus. It's our state capital. And the two major climate hazards that we are most likely to face and have the most impact on our area are rising temperatures and increasing precipitation. So, for instance, our climate is warming faster than the national average. And in particular, low temperatures are warming faster than high temperatures based on historical data from 1951 to 2012. The annual average temperatures have warmed by 2.3 degrees Fahrenheit. The average low temperatures have warmed by 3.6 degrees Fahrenheit, and our average growing season has increased by over 25 and a half days. So these trends are expected to continue, and by 2050, we estimate that our area could experience up to 5 degrees Fahrenheit warmer temperatures on average. And similarly, precipitation totals are increasing dramatically during the wet seasons in Ohio. If we take a look at our region, the Midwest, we're experiencing more frequent and intense rainfall events. In May of 2020, there was a very significant flooding event that occurred in Columbus and the surrounding region. And our region has seen an approximately 36% increase in rainfall during the heaviest precipitation events when compared to historical averages. So some of the other impacts that we're experiencing, aside from the changing in temperatures and precipitation, is deteriorated air and water quality, a shifting of natural resources, and also changes in the availability of water. So we know that our adaptation efforts must be in tandem with mitigation because the climate is already changing. And we are building upon existing initiatives and leveraging work that's currently taking place and ongoing with other partners and looking ahead to expand our efforts.
Great. Thank you so much. So partnership and collaboration are critical in addressing climate change. Dr. Henderson, can you speak on your experience with collaborative engagement when creating local climate action?
For sure. One of the things that I think that is not mentioned enough is the fact that yes, the climate is changing, and it's changing the way in which we're able to inhabit the earth, but it's also changing people's personal health, their access to health needs, and also their ability to survive the climate that we live in today. And so it just so happens that the majority of people who experience the worst effects of climate change are those that, number one, don't really have a hand in causing the majority of it, but also those that that have the most problems surviving it as well. And so climate change is a threat multiplier. And so social determinants of health, which are where you live, where you work, your education, et cetera, your class background, all those things are negatively affected by climate change. And so here locally in Miami, the same individuals that fight for fair housing or livable wage and things of that nature that are related to the social determinants of health are now seeing that they also have to worry about climate change and the effects of climate change on the constituents that they serve. And so what we do is we partner with those organizations. We help them educate their members, and we also help respond to their members during disaster as well. So the resiliency efforts are focused in marginalized neighborhoods and poor and Black and brown neighborhoods of Miami-Dade County. And we recognize that by focusing on this community, we get the most bang for a buck, basically. And so, yes, we partner with those organizations. We have workshops and other activities that we target towards them. And we all, these are the first individuals that we respond to as well. And so working with those local organizations to identify individuals that are at highest risk are also top of our priorities as well. And so, yeah, that's basically how we help mitigate climate change on a local level.
That's great. Yeah, partnership is really important, and Eco America has always been a really great partner for NEHA, and bringing us all together for events like this and connecting that way. Nikki, anything else to add on the importance of partnership and collaboration in environmental health and climate action?
Yeah, for us in Franklin County, collaborating and partnering with other public and private entities, as well as local academic and other organizations is not new for us, and we're very familiar with that. And so it's been really, really important to leverage those resources that already exist and that are around us. And so we have found that by partnering and reaching out to other agencies, the work that we're trying to do doesn't come with any funding, really. And so it's extremely important for us to partner and collaborate with those who are in this space as well. So some examples of projects and initiatives that we've taken on. Equity is our North Star at Franklin County Public Health. It's what drives all of our programs and initiatives. And so we have partnered with the Mid-Ohio Regional Planning Commission to complete a project with support from Thriving Earth on a hyper-local neighborhood air quality monitoring project. And this is the first time that Franklin County Public Health has been able to get involved with air quality monitoring. So we've been really excited, and hopefully the data will be analyzed over the course of a year, and will show any areas of disproportionate vulnerability where we can then implement some targeted interventions based on that. And we're hopeful to continue that program into the future. We're also working with the Franklin County Soil and Water Conservation District to implement a component of native planting and native landscaping with local businesses that are signed up for our water quality partnership. We've connected with the City of Columbus. They put together a climate action plan, and it's very comprehensive, very aggressive, and very needed. And so we have connected with the City of Columbus and are working to plug Franklin County Public Health into that anywhere possible in order to further collaborate and expand the work that they are taking on. One example of that would be a tree canopy study that we're embarking on with them. And we're also working to connect with multiple partners at local and neighborhood levels to really get down into the grassroots. It's local, and getting into the neighborhoods and speaking to folks is extremely important.
Great, thank you. I think we often talk about in public health, don't reinvent the wheel. If something's working great at certain, health departments or other organizations, we encourage to hear about those success stories, hear about those challenges. So thank you for talking about that. As we know, throughout the last 2 years, public and environmental health has been pushed to prioritize COVID-19 response. However, climate change continues to impact our health. Record-breaking wildfires in the West, flooding in the Midwest, drought in the plains, extreme storms in the South, extreme heat, and increase in vector-borne disease, poor air and water quality. Nikki, can you speak about how Franklin County Public Health has worked through some of these challenges of competing priorities and lack of financial support?
Sure. So a few years ago, we recognized the need to address sustainability and climate change. And my interpretation of our local and state codes in administering some of our solid waste rules, we know that landfills are contributors to climate change. And so we really took a look at how can we fund sustainability program and initiatives when there's no funding really coming in from the state. And so we redirected our approach and put together our sustainability section, and have really expanded to address healthy housing, lead, asbestos, our landfills and our composting facilities, recycling, working with our solid waste authority and our municipal and solid waste facilities, and other partners like our soil and water conservation districts and the other partners that I previously mentioned. And then COVID hit, right? And so all of our priorities were directed to that. And every effort was made to address our COVID response. But what we were able to do was really keep a few targeted staff still focused on the sustainability and climate change work that they were doing previously. And, trying to spend a few hours here and there on those initiatives, even though COVID was there, the other work didn't stop. And I don't know of another health department where the work, that they do on a day-to-day basis ever really did stop. It's still there. And so it's really a delicate dance to balance those priorities. I'm really glad to see that the team that we have in our sustainability section are so committed to what they're doing and helping folks to achieve optimal health. And so we address determinants of health on a daily basis. Environmental health is uniquely poised and positioned to address determinants of health because we're there with people on a daily basis. And it just makes sense to also address climate change and sustainability as a profession. So in terms of funding, we don't, in Ohio, there is no funding from the state currently. However, we are actively reaching out and in conversation with our state health department and others to hopefully change that. It's gotten enough exposure through our Ohio Public Health Association, Climate Resiliency Coalition, and the conversations have begun. So we're hopeful, fingers crossed.
Awesome. Thank you so much. You are correct. I mean, environmental health are the boots on the ground. And you know, in this session, we're talking about local action and, like you said, uniquely poised to be in that position to make those actions. Climate change and its impacts on health are happening in our own backyard, and action must be taken now. Dr. Henderson, as we're wrapping up here before we go to audience questions, if you have questions, feel free to drop them in the Q&A. What is your call to action to listeners, and what can we do right now to support climate action in our local communities?
So that's a really good question. Firstly, I'd like to say that, you know, ordinary individuals can do extraordinary things when they get together and organize and talk and share ideas and meet at common ground. So that's the first thing, is to really get together with your neighbors. One of the things that we did with the coalition of organizations that we work with in Miami-Dade County is that we saw that, you know, the federal government, that the state and local government did not do a good job at responding to vulnerable communities, particularly during disaster. And so we got together and said, okay, we're going to respond to this community ourselves. We're going to use our resources and our relationships to feed people, to answer their medical needs and things of that nature as well. And that was during Hurricane Irma in 2017. We ended up, you know, knocking on thousands of doors. We ended up feeding 30,000 people. And this network of organizations grew into what we call the Community Emergency Operations Center. And now we're responding to people in other states and also in other countries as well, under the leadership of a young lady named Valencia Gunder, who is from the community here in Miami-Dade County. So definitely talk to your neighbors. The other thing that I think is important is to get political. A lot of these issues that face us, particularly those around social determinants of health, around climate, and even around things like war, which infects our environment as well, these demand political accountability and actions, and not voting for people who don't have the environment's best interests at heart. So getting rid of fossil fuels, investing in people and their resilience and livable wage and fair housing and things of that nature, all these things cannot withstand without some sort of political backlash. So we must get very political around these topics and not be brash when we're mentioning these things, or perpetrators that are against these things as well. And then the last thing that I mentioned in the disaster guide, which I hope you all can get access to, is called a medical professionals disaster guide, a medical professionals guide to disaster relief. It's in the process of being published, and that is that you can't do nothing. You can't sit back and say you want to save the environment and things of that nature and not take bold action. Running for office yourself, funding people's political campaigns that have a good message around the environment and around social determinants of health, I think are very good actions as well. So I would mention those things for sure.
Definitely. Thank you so much. We do have a few minutes here to answer some questions from the audience. I do see a few coming in, but as more come in, I'll start off with one. How can we use technology and innovative strategies to address local climate actions, or any examples that you can speak on how we can use technology?
Yeah, I can answer that. One of the things that we did during COVID-19, for example, we used our disaster framework to respond to vulnerable communities at the very start of COVID-19. All across the country, we were hearing that people were not getting access to tests. They didn't have the information and things of that nature. And so just right off the bat, we had a call for volunteers in which we trained them on the internet about how to question people about their exposure to COVID-19. Contact tracers were then used locally to figure out where the disease was spreading in vulnerable communities. And then particularly during disasters like during Hurricane Irma and the hurricanes that follow, we set up a Google map that showed all of the makeshift shelters that we had all up and down Miami-Dade County. And we connected people with other individuals who were medical professionals and things of that nature, who were on the other side of the state or on the other side of the country that still wanted to help out. So I think using technology now is our best friend, particularly to respond to disaster. We also partner with an organization called Information Technology for Good. It's called ITDRC. They're currently responding to people in Ukraine, but they actually help people set up databases and Wi-Fi and things of that nature, and they help us during disasters as well to set up those things. So I think information technology and technology in general is definitely going to lead the charge in terms of climate adaptation and change.
Awesome. Thank you so much. Next question we have, I think this is for Nikki. Can you tell us a bit more how you have dedicated staff to work on this regarding to funding their time and being able to solely focus on these efforts?
Sure, I'd be happy to. So we, as I indicated, took a look at how we are funded, and there is no money coming in from the state Department of Health or otherwise. However, we do receive funds for administering the solid waste rules. And so, we know that landfills contribute to climate change. And one of the tasks that we are charged with administering rules includes education. And I believe first and foremost, as registered environmental health specialists in Ohio, it is our duty to educate first before we enforce. And so part of that education is educating folks on how to properly recycle, how to properly dispose of their waste. And this is in turn a part of sustainability. So for me, it all goes hand in hand, and that is ultimately how we ended up funding our sustainability section, was through the fees that we receive through our solid and infectious waste program. And then grants, lots of them. Our sustainability section supervisor, Jenny McAdams, is a powerhouse for researching grants and other funding opportunities and going for them.
Awesome. Thank you so much. I think we have time for one more quick question. Can you share any examples of public health entities that have projects to reduce emissions? And again, maybe how they're funded, but just examples of public health entities that have projects to reduce emissions. Any thoughts on that?
I think so. There have been some efforts through Franklin County as well as the city of Columbus to address emissions. And I know with the city of Columbus, their climate action plan that was just released within the past couple of months does directly address emissions.
Dr. Henderson, anything else to add as we wrap up here in our last few moments?
Yeah, I mean, I would just say that, that, you know, if you focus on the effects of people and you use those stories of people to move individuals that are making decisions, that I think the people who are making decisions can easily make them. When you talk about the environment, abstract and things of that nature, it's hard to really see the effects of climate change. But when you do it, when you talk about people's health and their ability to survive, then I think that's what really moves the needle. So I would suggest that for sure.
Awesome. Thank you so much. Thank you to the both of you for speaking about your work on climate action in your local communities. We make an impact by working together. And with that, I will send it back to you, Megan.